Me and Kylie Vanderwist from CReST. We're going to be talking a little bit about who we are at CReST and how to engage with us. We're also going to hear from John Heldens from COMIRB about the COMIRB application simplification project. We're going to hear from Christy Williamson and Megan Pop at the CRSC, the Clinical Research Support Center, regarding their training resources. Haley Steinhardt is going to give us some workforce development updates. And then we're going to hear from Allison regarding some recruitment and diversity, equity, and inclusion workshop updates as well from the recent seminar. So I will just go ahead and jump right in. Let me go ahead and share my slides. Just give me one moment. Okay. Apologies. Thank you for bearing with me. Okay, and can everybody see that okay?
Yep.
All right, wonderful. Thank you so much. So I know many of you, but some of you I may not. My name is Erin McDonough, and I am the program director with the Clinical Research Support Team. And I'm here today with Kylie Vanderwist. Kylie?
Hey everyone, my name is Kylie Vanderwist. I am the operations manager here at the Clinical Research Support Team.
Thank you. And we are just going to talk to you a little bit about today about what the Clinical Research Support Team is and how we can help you with your research on campus. So I'll start out with the basics. What is CReST? Well, the Clinical Research Support Team is a central hub or resource that offers fee-for-service a la carte support for research conducted by CU faculty on campus. We support investigator-initiated and industry-sponsored or grant-sponsored or government-sponsored interventional, observational, and secondary research studies with human participants, so the whole gamut. We are here to sort of fill any vital gaps that you're experiencing in your research teams or your experience, offer extra bandwidth, and help you operationalize your research by providing necessary personnel and resources, kind of the right resources at the right time and in the right amount. So our mission statement is that we are a clinical research life cycle experts who support a diverse community of sponsors, patients, and investigators. We connect inspiration with execution to advance science and medicine and improve human life. And to talk a little bit about our roots, CReST was created in 2017 as a CTSA program to kind of fill those gaps in research support for investigators and teams that maybe did not have all the capacity to support their existing or new research projects, or may have needed, additional expertise that wasn't in their field. And we were just created to kind of fill those gaps. From 2017 to 2021, CReST grew from only a couple of members working on a couple of studies within a single department that we were supporting, but we expanded rapidly to a team of about 15 at that time. And then because of that rapid support and the increased demand that we were seeing, CReST was moved from the CTSA to live under the Clinical Research Operations Support Office within the OVCR. This allowed us to kind of increase our presence, increase our bandwidth, and increase the size of our team and support more research across campus. But our roots really are in the CTSA, and we will always be grateful and give them all credit in the world for helping us get off the ground. 2020 definitely brought some changes, and 2021, even into 2022, with the COVID pandemic. Like many other teams, we experienced a significant amount of turnover, but we have now navigated those challenges and we have completely restaffed. Today, our team consists of 11 coordinators, 2 full-time monitors, as well as a monitoring facilitator, who is going to start very soon. And we are a total of 16 research professionals, and we are still growing as we see increased demand across campus.
So 2022 was a busy year for CReST, and this is just giving you a high-level overview of what CReST was doing this past year. And so we supported 89 different studies across 24 different departments among 58 unique principal investigators, which is a lot for a single group. And as you can see on the bar graph at the bottom of this slide, you can see that we support a variety of different departments and disciplines. And I think that's one thing that's really a benefit for the PRAs and the coordinators that work at CReST, is they get exposure to such a variety of different disciplines, departments, and PIs. As you can see, we have HEMONC and BMT is kind of takes the cake for the research that we supported, or the department that we supported. And then it's followed very closely with endocrinology, cardiology, and dermatology. The pie chart, oops, sorry, can you go back here? The pie chart to the right just shows a breakdown of the type of CReST support that was provided to these different studies. And so, like Aaron mentioned, we're kind of a unique entity in itself because we're kind of an a la carte. So the PIs can come to us and use us for everything from startup to coordination to closeout, or they can kind of pick and choose what they really need support for in that moment at that time. And so the majority of our support is that coordination plus, and that means that we helped with startup, regulatory, administration, as well as coordination. And then the other one that takes the biggest bucket is that startup and admin and regulatory. The other bucket is one-off or individualized services, such as just helping with invoicing, financing, secondary research submissions, or database builds. Next slide, please. So what services does CReST offer? So the first kind of big bucket service that we offer is startup and administration. And this takes on a variety of different pictures. So it can be just helping with budget negotiation and preparation. It can help with just sponsor invoicing. And so even though we're talking about these big bucket services, there's kind of different components to each one. And that's where the PI can say, like, oh, I really just need help with sponsor invoicing. There's a backlog. The second service that we primarily offer at CReST is IRB and regulatory. So that's submission to the HSR, PRMS portals, external IRB review, helping prepare those documents if it is going to COMIRB, taking like the informed consent and getting it into the template, and then fielding all those questions with the IRB, from submission to helping with amendments, to preparing source documents or participant visit packages. Finally, the other kind of big component of that pie that you saw on a previous slide is the clinical coordination. And so we have 11 coordinators, full-time coordinators right now that are on our staff, and they are on a variety of different studies like you saw, and that can be from a very simple study that is just administering surveys through REDCap to a very complex nuke med study where they're really having a lot of patient face time with the participants and helping them get those necessary research drugs. So they work with PIs, they act as study liaisons with the PI, with the sponsor, with different CRO businesses. They schedule visits, they complete the visits, so the whole gamut for clinical coordination.
And then finally, the last service that's kind of one of those big buckets that we provide is clinical monitoring, including developing monitoring plans, source data verification, conducting site initiation, interim, and closeout monitoring visits, and doing ECRF development within electronic database capture systems. Currently, we do have the bandwidth to provide startup and administration, IRB, and regulatory and clinical coordination services right now, if you were to contact us today. However, monitoring, we are still staffing up our team, and we have several studies in the pipeline. So right now, our monitoring team is at full capacity, and we don't have a current horizon on when we'll be able to take on new studies that aren't already in the pipeline yet. But that may change as we are continuously making offers to new monitoring candidates. So please keep us in mind anyway, if your timeline is a little bit further out, like maybe a couple months. And please still feel free to contact us about your monitoring needs. because we're hoping to really expand that bandwidth soon. And I see that we have a question in the chat. Deb McAllister says, are these primarily industry studies that you're supporting or IITs? I would say that it's a mix. For monitoring, it is 100% IITs right now. However, for the other studies, definitely for startup and administration, where we're doing more of the budget negotiation side, that's obviously more industry. But I would say across the board, it's a pretty even mix between IITs and industry. And then we also have NIH funded or even NIH sponsored studies. So our services and pricing, as I said, we are a la carte. We do charge hourly for our services. So our investigator-initiated rates are obviously discounted from our industry-sponsored rates. And the investigator-initiated rates currently for startup and administration, IRB and regulatory services, and clinical coordination are 65 right now. We haven't raised our rates in 3 years, so we are going to raise them by 6% starting July 1st. So they'll come up to 68. For industry sponsored, it is $88 an hour for right now. It'll be $93 effective July 1st. And then for monitoring, our services are $88 right now for all of our investigated initiated studies. We don't generally encounter industry sponsored studies. Generally, if we're monitoring, it's usually because this is an investigator held or university held IND or IDE study. Although that's, if you need monitoring services, please do not hesitate to get in touch with us for an industry sponsored study. And then effective July 1st, those rates will be $93. So the benefits of using CReST. Well, as I kind of have already touched on, it's about providing the right services at the right time in a timely manner. So we have the benefit of being able to customize precisely to your bandwidth and your needs. If you just need, if you need a coordinator to add to your study for 10 hours a week, but you don't actually need to hire another full-time employee to be able to operationalize a study, that's a perfect time to come to us and engage us. We also generally assign more than one coordinator to each study. So if you have if you have somebody go out of town, if you have PTO to deal with, if you have turnover, you're kind of insulated against that because we do assign that backup. And just to clarify regarding expenses of that, we do not double dip for training. If we assign 2 coordinators to a study, but the study only needs about 15 hours a week of support, so it wouldn't justify training an entire additional coordinator. That's just for our own coverage purposes and level loading. So we will only bill for the training time for 1 coordinator. We won't bill for 2. Same with team meetings. If you have a PI meeting with a team of coordinators and we have 2 coordinators assigned to the study, we won't have them each bill an hour meeting. We'll just bill for 1 hour. So we try to be really cognizant of your resources and your time, but yet still be able to provide that kind of flexible bandwidth and insulated coverage to you. The other great benefit is that we handle all the hiring training, general CU training. Obviously, you'll be involved in the study specific training. HR oversight, we manage all of that. So that burden comes completely off of your plate. And of course, we do minimize turnover impact and study delays due to onboarding training and getting system access because our coordinators are already well onboarded and all they have to do at this point is be onboarded to your study. And I do have to say, I'm very proud of my department. We have such a great group. Our coordinators and monitors, they are so passionate and so engaged. And they now have, such great experience, so many of them conducting research or participating in research and facilitating research at CU. We have some coordinators who have been in their positions for about a year, and some coordinators who have come to us with like a decade of experience. So it's a great group, and often we're able to assign coordinators who have previously worked in the area of the study or have a special interest in it, which just really helps with that engagement as well.
So how do you get in touch with us, or how do you get started with using CReST services if you think this would be beneficial to your project or to your department? So we have a CReST help request form that's on our website. So if you go to our website, there's a button to complete this intake form, and it asks you some basic information about like what services that you need. It has you gauge kind of the number of hours or the total FTE or percent of FTE that you're requesting for. And then if you have any of the documents like a protocol or informed consent or a draft of it or a budget, there's upload areas for that. The only information that is required is contact information and some basic information about the study that you're requesting help for. So it's a pretty easy form to complete. Once we get that, we'll reach out to you based off how you answer. We ask you if you want us to just look at your calendar, to email you, or if you would reach out to us with a time. And so then we set up a meeting with Erin and I. Typically, if it would be with the monitoring team, it would be with Erin and Carolyn, the manager of the monitoring program, to just chat about what the help you need and chat about your project, to get some questions answered and just to get more information. If you do decide to move forward with CReST services, then we would start working on a CReST service agreement, and we would send that to you for your review, for your input. You can make edits to that as you see fit, and that's always, we can always amend those service agreements. So if at any time we have a service agreement in place and you say, oh, like I don't need CReST help anymore, then we can end our relationship. If at any time you had said all you needed at first was clinical coordination, but now you need help with budget and startup and all of those other aspects, we can amend it to include those services as well. Once that's in place and your study is kind of ready to go get up and running, or our relationship and our role within your study is ready to get up and running, then we'll begin work with you and your study team. Next slide. So once again, thank you so much for your attention. Please get in touch with us, visit our website that has that CReST help request form. You can also reach us if you're not sure you're at that place to kind of fill out that request form yet, you can just email us at crest@ucdenver.edu, or always just email Erin and I. So thank you for your attention, and we'll take any questions now.
Hi, Erin and Kylie. This is Emily Andrews. I am just kind of curious, what is the general expected, like say we have someone who's out unexpectedly, is there any scenario where you guys could step in to help in that case? Obviously, it'd be ideal if it was more a pre-planned, someone's got an upcoming like out of office for like a week and they know in advance, but what about those kind of like, we're in a pinch situations? Are you able to help with those for coordinating? Sorry, specifically.
Yeah, absolutely. I mean, that's kind of what we're here for, those kind of emergency or just short bandwidth situations. You suddenly get a study opportunity you weren't expecting, or somebody's going on leave, or, you have a turnover situation. Honestly, that's a turnover situation is often where we get brought in. So then the only rate limiting factor from the coordinator side, if you need coordinator services, is just getting the coordinator trained on your study. So
yes, okay.
But yeah,
so that would be a situation where obviously we wouldn't fill out the form. We'd maybe just email you guys quickly and kind of set something up to.
The form actually, we still try to push everybody through that form. And I know everybody's sick of red cap forms. It's really short and most of the fields aren't required. It's just kind of the same questions we would ask you in an email before we set up a meeting. So
okay, perfect.
And we get notified right away when it's completed. So we're pretty quick to turn and burn with reaching out to you to set up that meeting.
Okay, so it sounds like it might be helpful just to fill it out, and then if we have a need at some point, we're already set up.
We use the form to kind of alert us to new studies that have a need right away. And then from there, we set up a meeting and review whatever you told us. You're just sending us the type of study, what services you need, and like any other information you want to provide in the protocol. We'll review that, just set up a meeting with you, and then put together a CReST service agreement from there. So whenever you are, I mean, it's a really short form. It's not like the HSR or anything like that. But whenever you are ready for us to actually set up a meeting, and just even if it's not, you're ready to engage with CReST yet, but you're ready to have that initial conversation about your study needs, that's when you should go ahead and fill out the form, and then we'll reach out to set something up.
Okay, perfect. Thank you both.
Can you just clarify which hospitals you work with?
Yes, thank you so much, Allison. So we work with CU faculty, and we can work in the UC Health Metro Denver facility. However, we cannot work in Children's Hospital. We can do monitoring there in limited circumstances, but just the onboarding and access for our coordinators to be able to go into CHCO spaces is just not, it's just not feasible for us to provide coordinator services in there. So thank you very much for bringing that up, Allison. And as far as the VA, most VA studies that we have worked on, we are actually conducting a lot of their procedures in the CTRC, and we only need to set up an IPA with them to be able to engage with them. However, we do have one coordinator right now who is walked. So if you need to do study, if you need study services actually in VA facilities, we can help with that. Just get in touch with us early about it. All right, well, thank you very much. I will go ahead and pass it over to John Heldens to give us an update on the COMIRB application simplification project.
Thanks, Erin. Good to see everybody. We have initiated a project to simplify the COMIRB application. We are working with the School of Medicine's Institute for Healthcare Quality, Safety, and Efficiency. And we're partnering with the Cancer Center and Barbara Davis, Tiffany Cole at the Cancer Center, and Barbara and Tricia Giswaldo at Barbara Davis. And the big goal is to make your life easier, our lives easier, simplify this form, shorten it quite a bit, eliminate redundancies, eliminate everywhere you have to cut and paste information from the protocol into the application. I'm going to post a quick link here about the project. It also has a link to a survey that we're asking everybody who's filled out the application to take, or at least if you've done it in the last year. This is the main application form for COMIRB, not the secondary research application form. And one of the nice things about working with the School of Medicine on this is just getting some coaching on the project, and we're going to collect some data before and after. So this is just a very simple, short satisfaction survey. So we can measure at the end of this that we reached our goal. And if you want to sign up for some focus groups that we're doing, you can indicate your name and email address at the end of the survey. Those are for testing the new questions, if you will. The most important audience stakeholder in this application form are the researchers, the people filling out this application form, because if it doesn't make sense to you, it's not helping us. So we really want to make sure that the way we phrase new questions makes sense and is intuitive to you. And we know the application has a lot of parts that are not intuitive. That's it. We're excited about this. This is going to happen this year. And if you can take a few minutes and fill out the short survey, I would greatly appreciate it.
All right. Thanks so much, John. And if anybody cannot see that link in the chat, please let me know. Any questions before we pass the baton over to Christy and Megan? All right, Christy and Megan, take it away with some training resources from the Clinical Research Support Center.
Awesome. Thank you. Hi, everybody. All right, here we go. Thanks so much for having us today. I'm here to talk to you all about training, the resources that are available to investigators, research coordinators, anybody working on human subject research here on our campus. So happy to be here today. So the Clinical Research Support Center, the CRSC, provides a whole host of education and training. These are done through regular classes and seminars, but also can be done one-on-one or for particular study teams or departments. Reach out to us if you have a particular training that you're looking for, and we are happy to tailor it to whatever your needs are. We have an incredible group of instructors. They include faculty, CReST staff, COMIRB staff, and other collaborators with lots and lots of experience under their belts. We offer a CTSA series of classes, and these cover a whole variety of human subject research topics. We also help facilitate the responsible conduct of research, the RCR training that's required for those that are supported through NIH. So all of our classes are available for everyone. They are free to take, and you can retake them as a refresher if you need to. We're always happy to see return customers to some of the classes, and we understand that there's a lot going on and a lot to learn, not only on our campus, but in each of your roles. And so if you take a class right after you begin, and then down the road, 6-12 months later, want to come back and take it again, you might learn something a little bit new, but know that it's okay. It's okay to come back and get a refresher whenever you like. All of our training is split up into different levels, just depending on what type of learner you are. So we've separated them out into beginner, intermediate, and advanced levels. They do not need to be taken in sequential order. So just know you can hop around to different levels if that suits your role and what you're looking for. So here are our beginner level courses. Informed consent, overview of a process. So that talks about not only why informed consent is necessary and needed, but how to conduct the discussion, and then also how to write a good informed consent document. CTSA 3 is all about the Clinical Translational Research Center, the CTRC. So this is done in person. It's our only course in person currently, and it's held at the CTRC Outpatient Clinic in the Anschutz Health Science Building. It is conducted by the nursing staff at the CTRC. So they provide a tour of the clinic, and then they also do hands-on training for obtaining height and weight and vital signs. This is the only course we have that is also limited. So we all have a max of 8 people that can attend, and that is just due to space in the clinic and then those hands-on training capabilities. So if you're needing to take this course, please be respectable and don't show up. We've had a rash of people just walking in, and the CTRC staff is gracious and accepts them, but we do also have a wait list for people wanting to attend this course. Also in the beginner level courses is overview of human subjects regulations, and that is a fun course to take. It's provided by COMIRB staff. And then we've got COMIRB's Beginner Guide to InfoEd. So this is a hands-on training over Zoom on how to navigate InfoEd. So our intermediate levels of courses include submitting an initial application to COMIRB, and then reporting to the COMIRB. So requirements after that initial approval. So submitting things to the IRB like UAPs or amendments, study closures, things like that. Continuing review, everything after that first approval. We also have recruitment and retention of study subjects class, clinicaltrials.gov, and secondary research. Our advanced level classes are listed here. Everything you need to know about using COMIRB as your SIRB, your single IRB. We have a protocol development for faculty and researchers. This is a hands-on workshop for writing a protocol, developing it. and it's meant for junior faculty. And at the end of the workshop sessions, the protocol should be in a form where it is ready to be submitted to SARC and or the IRB. In conjunction with that, we have a protocol writing for human subject research lecture that is taught by the same instructor that does the protocol development for faculty and researchers. Highly recommend both of those. And then we have our CAPA class, so corrective and preventive action plans in clinical research, why and how they're important and needed, and how to write an effective CAPA. So a little bit more about our RCR training. This training satisfies the NIH requirement for instruction in the responsible conduct of research. We offer this seminar twice a year during the academic year, so it's held on the first Wednesday and Thursday of each month. Each session lasts 90 minutes. And by attending 8 out of the 9 sessions, fulfills that NIH requirement. And we provide certificates of completion for those requirements. And then right now, these are all offered via Zoom, and we do require attendees to have their cameras on and engage in discussion. This is also part of the reason why these are 90 minutes, to really fulfill that time to not only understand and get the information, but to allow time to interact with one another and engage in the content and have really wonderful discussions. Okay, so how do you register for these courses? For CTSA classes specifically, it's a multi-step process, and we are happy to share these slides so you can see all the different steps to find these and navigate Skillsoft easily. So you log into mycu.edu, open up Skillsoft, and you'll see a screen where there will be 4 buttons at the bottom, and you'll click on the CU Denver Anschutz button, and it'll open up this page for you. So on the left-hand side, under categories, clear down at the bottom, you'll see instructor-led training, or ILT. Open that up, and it will give you some other selections to choose from. So pick CU Denver Anschutz Clinical Research, and it'll pop open some subcategories. And this is the levels of courses that we have. So select either basic, intermediate, or advanced, whichever you're looking for. And it'll provide the list of courses under that level for you. So select the course you're looking for, click details. And once you hit details, it's going to show you all of the upcoming sessions, dates and times that they're available. And then from there, click enroll. And you'll receive an email that has the Zoom link for you. It has an option for you to add the event to your calendar, all the information you need to attend. And then at the end of the course, we enter in everyone who's attended, so you get credit for being there. All of that credit shows up in your learning transcript, so it's tracked through Skillsoft. In your learning transcript, not only can you see when you attended the course, but you can print off a certificate of completion if that's what you need. So same way to navigate there, through mycu.edu, opening Skillsoft, and then click on your learning transcript. On the Clinical Research Support Center website, we have a training calendar, which will show you all of the upcoming courses, when they're happening, how to register for them, any other pertinent information you might need. We have a CTSA class list that will give you descriptions of all those courses. And then we also have RCR series information listed here on the Research Integrity, Responsible Conduct of Research webpage, where you can see what trainings fulfill those NIH requirements, how to register for those, and any other pertinent information for RCR. And then here this is the link for the CRSC website, and then our email address. So reach out if you have questions about the courses, registering for the courses, looking for your learning transcript, anything related to education, or if you want us to come and provide training for your group, happy to do so. Does anybody have any questions? We'll open the floor.
Well, Christy, I just want to say thank you so much for sharing this information. And I'll say from experience, Christy's group is great regarding that one-on-one training. Her group came and did a presentation on essential documents and regulatory binders for our group at CReST. So we were really grateful for that. Also from experience, if any of you have CReST or ACRP certifications, many of those CTSA series classes can be used towards your continuing education. So, you may want to get in touch with CReST or ACRP just to make sure that their policies are still the same, but having personally used them to renew my CReST certification, they've been good in the past.
Thanks so much, Erin.
All right, if there are no other questions, I will pass it over to Haley Steinhardt. Haley, I think you have some workforce development updates for us.
Yeah, thank you. I just wanted to remind everyone, we started a Teams for really the community, for all clinical research professionals, just to have another sense of community and working in the hybrid environment. I know some departments are fully remote or some positions are fully remote. So wanting to make sure everyone feels included. It is called CU Anschutz Clinical Research Community, and we'll be sure that that can get shared with you, maybe with these meeting minutes. You can join. It's a public channel for those in the system, and it's really just open for whatever you'd like to ask. People have answered each other's questions, posted questions to each other. We're creating some resources based on some trainings people have done and liked and recommended. And then part of the workforce development is also a new group we started called the Clinical Research Roundtable. We came up with a name, and really the purpose of this in-person opportunity is for community to be able to dialogue, talk through problems that maybe you're having, maybe you just started and you would like some other people that have maybe gone through the same thing. You have questions, or you just want to network and get to know each other. I know some people are moving from out of town for this position, and so just a place of community and connection. The next one will be May 17th on a Wednesday, in person, Academic Office 1, AO1, 5101. And again, it's really more about dialoguing rather than a presentation. So if that helps you to understand the purpose, the dates are posted in the Teams channel that I had mentioned, and you can add it to your calendar from there if you're interested in that. And we'll continue to post all those opportunities. And really the feedback came from the meet and greet that we did a few months ago that many of you attended. And that's kind of the round table now is that spinning off based on your feedback on that survey. So thanks so much. More to come from workforce development, and happy to add people manually if you're not able to figure out how to join the channel. But you should be able to search it in Teams if you've used Teams before, and you can search for the channel, and then you just plug in that CU Anschutz Clinical Research Community name, and you should be able to find it.
Great. Thank you so much, Haley. I really appreciate your group putting together this great networking resource. If there are any questions, sorry, go ahead.
Haley, I keep getting asked when people are going to hear about the results of the survey that they took. Could you just give us an update?
Yeah, we're working on putting together some infographics to be able to share so that it's in a little bit more of a meaningful way, digestible way, and want to make sure that we've allowed leadership to see the results of the survey as well, so that they understand what some of those results are. So we're working on those infographics. So very soon, and then to be determined exactly how many opportunities to share those, whether we would do a webinar or use maybe this meeting if there's time or agenda. So hopefully in the next couple of months, you'll be seeing the results from the survey come out.
Thanks.
Thanks so much, Haley. And then finally, our last item, I think Allison is going to talk to us a little bit about the recruitment and DEI workshop.
Okay. So just an update. We had a workshop, a 4-hour workshop for those who were kind enough to give us their time for 4 hours in collaboration with the Office of Community Engagement, Diversity, Equity and Inclusion to start to begin a conversation around sharing experiences and how we want to continue to collaborate in research recruitment. So I think people responded very positively. It was kind of in part a networking opportunity. It was in part the beginning of a conversation around what sort of centralized resources people were interested in seeing being developed, and then also to start conversations around potential collaborations with industry and what that would look like. Despite it being 4 hours, we ran out of time. And so the feedback was that people wanted to meet on a regular basis. And by regular, they were talking kind of quarterly. So there is going to be a follow-up survey for those who were involved, just to start to hone in on both networking opportunities and what those follow-up meetings could look like, and also to start to broaden this out to everybody on campus. And then we're going to have some follow-up conversations to just continue to think about centralized resources. So we'll be feeding back on the results of those surveys and have a more formal presentation coming up. But just wanted people to know that these conversations are happening, and we're interested in everybody's input. So please don't hesitate to feed back if there are resources in this area that you would like to see developed. The main ones that came up were translation services, but a recognition that translation services has to be very tailored to the community in which you are wanting to work with, because Spanish isn't Spanish. There are various iterations of, so getting very specific. And the other was e-consent were the main ones that kind of came up, but we shall see where things go. And I'll keep you posted on the date. We're probably looking, I want to say June, July for the next meeting.
Excellent. Thank you so much, Allison. And who should folks reach out to if they want to share their input or feedback in the meantime?
Either Ben or myself. We're happy to take, or actually, I think Jama
Bettis
is on. Is she on? Yeah.
Yes, I'll put my email in the chat. You can also feel free to email me as well.
Do you want
Thank
to
you so much,
introduce yourself, Jama? So I'm not sure everybody knows you.
Yeah, hi everybody. My name is Jama Bettis. I am the Research Special Projects Manager in the Clinical Research Operations Support Office. So yes, you can reach out to me about recruitment, DEI, other special projects, anything like that. I'm happy to chat with you.
Thanks so much, Jama, and thanks, Allison. That brings us to the end of our agenda for today. So if there are no other questions, we will go ahead and wrap up and give you a little bit of time back. The slides and recording for this session will be sent out at the end of the week to the attendees. And you can also find the upcoming dates for clinical research connections meetings and registration links, as well as the recordings of this meeting at the end of the week and previous meetings before this on the CReST website. Just scroll down to the bottom of the page. I will go ahead and share that link in the chat for you. Thank you, Natasha. We're on the same page. Other than that, just in case anybody wants to recover some of the links in the chat, I will stay on for just another couple of minutes. But we will go ahead and wrap up for the day. So thank you very much, everybody, for your time and attention and for joining us. And again, if you have any suggestions for topics that you'd like us to cover during the summer season, please either email me, or please feel free to email clinicalresearchconnections@ucdenver.edu. Thank you very much and have a great day.